Joining me right now, Republican strategist Evan Siegfried. Evan, you call the idea of single-payer insanity. Walk us through why it's so dumb.
Well, you know how Nigerian princes send out emails to people who are easily scammed? That's the same people who like single-payer health care. They think it sounds great. It's going to be
the
perfect.
Democrats, in other words. Is that what you're saying?
The far left. I've actually spoken to one or two Democratic doctors who are rational and understand single-payer is a disaster. Even forgetting the idea that it's okay to try and help people, it's a fiscal nightmare. The state of California just passed in their Senate a bill giving single payer. It's estimated to cost $400 billion a year, except the annual budget for all of California is $180 billion. And the Democrats in California are saying, oh, no, we'll just pay for it because we won't be paying Medicare and Medicaid and a slight tax increase.
Are you worried that this has any legs at all, though?
I think it does, because you're seeing national Democrats like Chuck Schumer going out and saying this is something that's coming up. Kirsten Gillibrand was in Central Park on Saturday telling young kids, hey, if you know the real way to lower costs, it's single payer. It's actually not. It's been projected from nonpartisan studies that if we implemented single payer, federal spending would increase $32 trillion over 10 years.
Look, I mean, and then you'd have taxpayers effectively on the hook for all these escalating medical prices and costs, which you can only anticipate. I mean, this is any Econ 101 textbook will tell you this and lay it out. Without any kind of competition in the marketplace, if the government's footing the bill for everything, yeah, prices are going to go up.
It's not only that. Democrats will argue that they aren't going to go up because we're just going to be using Medicare and Medicaid payments in order to pay for single payer. Yeah. That's not reality. Every study shows that they would need to raise taxes and raise them double digits, at least 15%.
But I mean, look, the Republicans have the House, they got the Senate, they got the Oval Office. Yeah, they can't seem to get health care repeal and replace done. But to go from that to single payer, is your concern that if they don't get anything done, the Republicans for that matter, that they then get voted out of office and something like single payer comes in?
Well, if Obamacare crashes like the president has said it's going to, you're going to have a lot more nervous Americans. And when they hear something like single payer, which sounds great, they're going to say we're all for it without knowing the details of it. Every study, and especially in California, has shown that once people start hearing the details, it becomes less and less favorable. Think of somebody in New York City who pays up to 40% of their income in taxes because they're triple taxed at the local, state, and federal level.
And
then you want to add more taxes to pay for that? Well, why don't we just give them all income?
Well, why don't we just all move to France anyway?
Well, the food would be better.
The food would be better. Look, Evan, it's good to see you. Thank you so much.